A doctor from Abergavenny is currently being investigated by the General Medical Council after prescribing sex change hormones to children as young as 12. Dr Helen Webberley has done so against current guidelines. Well, Dr Webberley joins me now in the studio along with Cat Burton, who is herself transgender. Welcome to you both and thanks for coming on to Wales at 6 this evening. Dr Webberley, if I could start with you first of all, why are you flouting guidelines that are in place at the moment?
Okay, so there aren't any guidelines on treating children on the NHS in the UK. There is a protocol that the London Hospital uses. I prefer to use the approach which is more widely used internationally, which actually listens to patients. It's called the informed consent model. So we listen to patients, we listen to their stories, we listen to them as a voice and understand exactly what it is that they need or require.
And the protocol that you talk about doesn't advise on treating children below 16 with these hormones, is that correct?
In the UK, the current protocol is that they're not allowed to have this particular kind of treatment until they're 16, and the kind of treatment that they are allowed is very prescriptive, and they have to do A before getting B.
And one of the things that the Welsh Government has said in this statement in response to this is the long-term effects of cross-sex hormone therapy are not well known. If I can bring you in here, Kat.
Yes, of course.
The children we're talking about are as young as 12, some who have been prescribed these hormones. If the long-term effects aren't known, do you think this is a road we should be going down?
I think that what Helen prescribes more usually are hormone blockers. And hormone blockers are a pause button. Hormone blockers allow children the time to consider their options.
So that effectively delays puberty?
Exactly. I mean, the blockers were originally developed for precocious puberty. So they're normally prescribed to kids as young as 4 or 5, which prevents puberty at such an inappropriate age. So Helen's prescribing those much later than they're normally used, to allow a transgender child to have time to be utterly sure that what they want to do is transition. It's not an easy path for anyone. I think what Helen does is actually save lives. I know of quite a few people who, thanks to the delays that are incorporated in the NHS pathway, the length of time it takes to actually go from seeing your GP to a specialist up in London, it allows puberty to develop until such time as that pause button is pressed, very often months or years after the child has asked for it to be pressed.
So looking at it from that perspective, you're incredibly supportive of what Helen is prescribing. Let's take a view now from David Davis, who's the MP for your area, and see what he has to say.
In my view, children don't always know what they want or what they are, and we shouldn't be making assumptions that just because somebody wants to, to play, if you like, girls' games or boys' games, that they need sex change medicines. I mean, I think it's absolutely ludicrous and worrying and dangerous for the children.
Well, we heard that word dangerous being used by David Davis, and on the NHS UK website, the guidance around gender dysphoria does state that most treatments offered at a younger age are psychological rather than medical or surgery, because once people reach puberty, they might change their minds, or we don't know exactly where their thoughts would go, so they're given a chance to see how that develops. What would your reaction be to that, Kat?
I mean, fabulous soundbite, but total misunderstanding of what the problem is. I have and friends who are going through puberty and are transgender. And if you do nothing, the do nothing model is not the safe option, because when a child gets to puberty, if that child identifies as female but is going through male puberty, they will have some irreversible changes taking place. They will grow facial hair, they will grow body hair, their voice will break. And if we can prevent that long enough for that child to be utterly sure of where they want to end up in life, that is a good thing. If we don't, all of those things can be intervened later, but it's very, very difficult. Electrolysis to get rid of facial hair can cost, tens of thousands of pounds, which the NHS doesn't provide. Voice, there's no surgery that effectively unbreaks your voice. A lot of hard work is what unbreaks your voice.
We could talk about this for a long time today, and I'm sure the discussion will carry on as well online. But for now, we'll have to leave it. Time is up against us. But thank you very much both for coming in today.
Thank you so much.